Good afternoon, everyone. Thank you for joining us for our panel discussion on education, treatment, and research with African American women across the U.S. We have a distinguished panel that we would like to present to you today, and we'll start to my left.
And I'm Victoria Cargill. I'm the Director of Minority Research and Clinical Studies at the Office of AIDS Research, National Institutes of Health.
And I'm Danielle Houston, and I am a public health specialist in Houston, Texas for Legacy Community Health Services.
And I'm Dazon Dixon Diallo. I'm founder and president of SisterLove Incorporated right here in Atlanta, Georgia, as well as adjunct faculty with Morehouse School of Medicine.
Wonderful. And I'm Mutepfa. I'm at the UCLA Center for Clinical AIDS Research and Education in Los Angeles, and I'm the Senior Community Health Program Representative. So we want to start with you all telling us a little bit about who you are and what you do. I know you said your names and your job titles, but what specifically do you do in communities and directly with women?
Well, I guess I'll start. In addition to working at the National Institutes of Health, overseeing the portfolio, taking a look at what we do fund for HIV risk reduction, prevention, treatment, and vaccines for women. I also care for women and all individuals living with HIV infection in Southeast DC.
Well, I have a lot to do with advocacy and patient education. Many times doctors will call me in to talk with women and clients who are newly diagnosed, new to treatment, are reticent to begin treatment or have failed regimens. And so I come in and discuss with them, try to get through just as much information as possible and really try to simplify the science, treatment, and research of HIV.
Well, oddly, maybe not, because I know you all wear so many hats. It's always hard for me to answer that question because a lot of what I do is so intersectional. But I do run a nonprofit organization that delivers direct services as well as advocacy and leadership development around women, HIV, reproductive justice, and sexual health. We provide testing, counseling, linkage to care services. We're also directly involved in providing community education and holding dialogues around clinical involvement, research, helping raise the research literacy and the health literacy of folks in our communities. And alongside that, I also do a lot of work working with women in community who are HIV infected and affected to become and to remain and maintain their own health and well-being as leaders on behalf of women like them in their communities. And just on another tiny bit of an aside, when we talk about doing the intersectional work, we're also making sure that we're addressing other issues of sexual and reproductive health and rights, access to contraception and birth control and protection for violence, protection for women in terms of sexual and physical domestic violence. And we're talking about making sure that the economic development and opportunities for women are also intertwined with their understanding of their health and well-being in terms of prevention and treatment. So it's a full scope and a full scale in terms of what we do, all the way from here to South Africa, where we may not be testing and counseling, but we're running a dairy farm with women's HIV/AIDS groups that can generate income and do what they need to do in their own communities.
Wonderful, and thank you all for that information. A beautiful reflection of the research and how that will take us into the end of HIV, the treatment aspect of it, as well as the education. So thank you very much for your work. So over the past 2 days at CROI, which is the Conference on Retroviruses and Opportunistic Infections here in beautiful Atlanta. Thank you so much, Dazon, for being the host city for this conference.
We're glad to have y'all. Trust me.
And we are glad to be here. We get to talk country when we come to Atlanta. So
That's
we
special.
Like that. So being here at the conference for the past 2 days, we've heard quite a bit of great information. Would you like to share some of your views, insights about the information that has been shared at CROI? And I won't ask a very direct question because I would like for you to share what has really sparked an interest within you, and how do you see that information being used in communities of color, specifically with women?
I want to start with the opening because I think that, for me, set the tone. To hear Lynn go back and talk about what it was like to prevent mother-to-child transmission. That start. Because I think when we think about that, it gives us a chance to look in two directions. We can look backward and see where we've come from. And those were tough days. I remember those days. And I was one of the co-investigators in 076 or a sub-investigator at a site, and it was painful to have those conversations. And we were fortunate, let's be honest. We hit the target the first shot out of the barn.
Dr. Cargill, for the sake of the people
Sure.
watching,
076 is the protocol where we provided AZT or Retrovir to pregnant women, and this was very difficult. You know, the legacy up until that point was you don't provide medications during pregnancy. It's a time of fetal growth and development, but we had this transmission problem where we had children who were born, and I would remind our audience, when children are born with HIV, we don't call them babies with HIV, they're babies with AIDS because their progression is so rapid. And I had spent years watching my patients and my patients' children die. So that this was really a big sea change. At the same time, I think it allows us to look forward and see where we've come. We now routinely have a whole series of rubrics and even guidelines. And yet, we continue to have transmissions, let's be very honest, in this country and around the world. So it's a reminder that while we've made progress, when you talk about the end of AIDS or how we're going to get to an HIV-AIDS-free generation, it is a good reminder that you've got a woman in a community context, a familial context, a cultural context, her own individual self, and then her child.
And I personally think that one of the things I've been most excited about was the announcement that we possibly have, person N equals 2 of people cured of HIV. And one of the things that, it wasn't just the cure, it was the fact that the cure possibly happened in Mississippi. And coming from Houston, Texas, and dealing with HIV in the South, there's a sense of hope. I feel like the South, which has the highest incidence of HIV infections, gets overlooked, especially with the research dollars. I'm hoping that this is a bit encouraging that this type of research can happen here, that this kind of collaboration with other researchers can happen here. And I'm also very excited that the baby was a girl. And so you have an adult male, you have a baby girl, that if anybody's sitting there and looking at what the face of a cure looks like, you can almost see your face in a possible cure. So we're 35 million minus 2, and we have a long way to go, but I think it's very promising, and I look forward to, to being part of it.
That's brilliant. Yeah. So it's interesting because what I've witnessed, and there's a lot in the science, and there's a lot to talk about in terms of that, but I want to talk about the folks who are here. And that it's striking me interesting that there's so many amazing scientists and researchers, and we've gotten some mixed bag news over the last couple of days. And yesterday was a particularly hard day, I think, because it just felt to me like a lot of our researchers, and we're talking specifically about some of the data that's come out of the VOICE trial that tells us really what we know we need to know. It wasn't bad news in terms of needing to sink into a depression and say, let's, as a Marvin Gaye thing, make you want to holler, throw up both your hands. It for me was, when I come to these spaces, I love learning what we've learned, whether we think it worked or not, what we've learned from it. And we had a community event last night that bridged the scientists and the community together. And what was interesting was that the loudest voices of hope were coming from the community advocates, from the women, from African women, from African American women who were just pushing, saying, we know some more now. You got to get back in there and keep that going. And so I think that that's what has impressed me and excited me the most. And the other thing about the last couple of days already, knowing that we've got a day and a half left, what has already happened, I think, is that unlike last year when we knew with CROI we were waiting for data to come out of the FemPrep trial, there was a lot of disconcerting outcomes in the sense that we thought that women, even though that was big news, there was this relegation of women sort of to the margins. Even in that conversation, it was just a poster presentation. Seems like this year there's been a much more deliberate effort to make sure that these critical issues around women's sexual health, around understanding more about women's endocrinology and women's bodies and our hormone and our sexual engagement, that seems to be an energizing force in this year's conference, and I'm really, really excited about that. And that we have something that can translate now from studies that have all been, for the most part, with regard to women, have all been done outside the United States. I think your point about this particular result being in the United States, but we also now know more about what translates to the United States. If I bridge what we learned from ICE's study last year and what we're learning from the Voice trial this year, I see the bridge, and I think I know where our work is.
And I know for me, it's been particularly interesting to see the paradigm shift and the dismantling of those silos of excellence, because we've all existed and been stellar in the work that we've done, but to see the science community fully embrace the behaviorists, the anthropologists, people that work in faith-based communities is amazing. And to see that shift take place literally right before our eyes, and for people to openly acknowledge, hey, I can't do this by myself. Exactly. And we cannot get to the end if I'm operating, without the help of my fellow scientists, because they are also scientists.
That's right.
Minus an MD or an MPH. They are equally scientists. And so that acknowledged to me is beautiful.
And can I say that acknowledgement, I think, is also simply being driven by the fact that we've given so much more respect and inclusion to the trial participants themselves, because that's where a lot of that real knowledge comes from.
Yeah, absolutely. So considering all of that, everything that we all just shared, what is the game changer for you? What will be the one or more than one thing that you take back to your communities, to your networks, to women that you work with directly, that will be a result of what we learned here? How will you take this information back and share it with communities to signify what will be your game changer?
I can start with that one. The biggest one is that I know I can come back to the communities that we work with, especially the women and young people, and say, you see, your engagement, your involvement, your advocacy, and your voice matters in research. And this is how we know. So that's one. The other game changer, I think, is just what you were saying. I don't think that you'll see, especially when we're talking about prevention, when we're talking about treatment, when we're talking about now this combined force around doing a lot more understanding of the role of adherence, for example, that the game changer is that I don't see a whole lot of more protocols going forward without an immediate integration and incorporation of clinical with behavioral and with social science. I just don't see us having any more success with trials without that fully integrated combination.
I think there's some other questions that have emerged, and I'm going to switch my hats between researcher and provider. So I'm going to put on the investigator overlooking the portfolio hat first. And I'd like to pick up on what Dazon said. I think it's not just that we can't go forward, but there's going to be a very strong push from us to look at including ethnographic data and trying to understand why. When you sit in a room with over 3,000 people and you can hear a pin drop because they're waiting to hear what's going to be said about voice, you know people are completely engaged. And when you see that and you see women reporting all this adherence and yet you can see blood levels telling you they weren't taking them, the question has to be asked, what haven't we been able to achieve? Where is the disconnect? How come we haven't? And I almost fell out of my chair when Jean said it. Why haven't we given women permission to tell us the truth about what they're doing? It was like, hello, finally. So that's one thing. I think the second issue that came up for me, now I'm going to put a little different spin on my research hat, is that we are trying so hard with these PrEP protocols, and we haven't really had the kind of success we want. But there's a drug in the pipeline that you could administer once a month, maybe even once a week, and you can have 100% blockage of simian transmission when these monkeys would just crash and burn. I thought to myself, we already have women who understand this from Depot,
Yes.
so it's not going to be a new model for them. This is exactly the kind of thing we need to watch and make sure that we see how it works. I know we're far out from that, but still there is possibility. And so then I'm going to end with putting on my treatment hat. There are a number of posters taking a look at viral shedding in the genital tract, and we've been looking at this for some time. Multiple investigators have looked at it. But to continue to confirm that that 350 cut point isn't academic, it's real. And that if you're below 350, that viral shedding is only going to get worse no matter where you are in your menstrual cycle, even if it drops before ovulation. And what does that mean for transmission through sexual activity? As well as if you're above 350, it might be better. And that for women who have genital ulcer disease, treating that isn't just about relieving your symptoms, but that even if you start to get visual improvement, you can actually drop the viral shedding. To me, says a lot about doing something I don't think we still yet do enough of, and Voice showed us that. It's not about using a condom or not, it's not about preventing transmission or not, it's about people have sexual lives and working with them within the entire context of that sexual life,
That's right.
without stigmatizing it or judging it.
That's right.
And I have a lot to just agree that I feel that the game changer is really the focus on youth. I think that for young men who have sex with men who are black in the United States, we've seen that the focus needs to be on youth. The international data is definitely telling us that most HIV infections for young women happen before the age of 24. And so this focus on youth, this focus on women, I think that the information about, contraceptions and whether or not they possibly increase a woman's risk. And I was in a meeting one day and somebody said, what do I tell my women now that are on contraceptive? And I said, tell them the same thing you told them before, that it only prevents pregnancy. It doesn't prevent against HIV or STDs.
Exactly.
And so we have that information. And then we also have this information that came out of Voice. Medications don't work if you don't take them.
That's right.
You can't wish HIV away. And being a participant in a clinical trial doesn't give you the same benefit as using the intervention of the clinical trial. And, going forward, I want to hear women's voices. I want to hear that I want there to still be hope. I want there to still be drive. I want there to still be activism and advocacy. I want them to work in traditional networks. I want them to join the clinical trials. I want them to join the advocacy boards. I want them to join organizations such as SisterLove. I want them to look forward and demand that they not be ignored. And I think that, as everyone said, that the voices are being heard. I just want them to go forward. I want people to understand that treatment doesn't improve your life, but it keeps you here to see the cure. And, and there are just so many things to be hopeful about. And that we've all, women are used to difficulties in life and getting over them. And you just have to, bring that same strength and the ability to endure and keep spiritual to the fight against HIV.
Well, our time is coming to an end.
What's your game changer?
Yeah, you have to tell us your name.
Wow.
Ask a hard question.
That is a very hard question. Because my work in research is very unique. I was talking to David Evans of Project Inform, and he said, Kaita, I feel like you have the hardest job in research because you have to represent community and you have to represent the researchers, and you cross a bridge continuously every day.
That's right.
And I love research, and I love working in communities, and I love working with women. And my game changer for me is that no longer, what I've learned from CROI is no longer is it a question of who should be in the room, if women should be at the table, how information is shared, but when, and implementing it and seeing it roll out. And so that's my commitment. My commitment is taking the information back and making sure that women know that they're valued, that they are needed, that we cannot exist in this world without women. And because of that, it's very important that they are involved, like Danielle so eloquently said, in all aspects of it, of all aspects of this process. And so that, to me, is a definitive game changer. But I wanted to ask, if you were to look in the camera and just imagine that there is, you can either speak to the mother of the child in Mississippi, you could speak to a 16-year-old in Houston, Texas, who lives in a foster home, or you can speak to a woman who was recently diagnosed who came into SisterLove. Pick any one of these women and look in the camera, and what would you say to her?
I'll start. And I'll pick the woman who's recently diagnosed, since I live that every week. And that would be to say that HIV infection is not a death sentence. It's a chronic illness that's completely manageable. And we know that you can have a near normal life expectancy, but you have to be in partnership with us as your provider. And do not be afraid to ask questions, to learn about this illness, and if you are not happy with your care and don't feel you are treated well, vote with your feet and find someone who will partner with you, because this is going to be one of the most important partnerships for your entire life. And that hope is on the horizon, that we will continue to make strides against this disease.
Thank you. I would like to say that just because I happen to today be sitting on this side of the table, it doesn't mean that I'm not you. I'm a woman. I have experiences in this world, and HIV or not, it is but a piece of the puzzle of your entire self. And so if you're HIV positive, HIV negative, you're still a valuable human being in this world, and you deserve the best. And I hope you get it.
Wow, well, first I'm going to tell you, congratulations, Mama. You have done it. You might have been late, and we're going to talk about that, but you might have been late to the game to make sure that your baby was healthy, but Lord, what you have done for the rest of the world is amazing, and you should walk with your child knowing what you all have accomplished. And here's the other thing, sis. Your child is going to learn eventually what she means in this whole world in terms of the end of this epidemic. And there will still be a lot of stories about why she was even at risk in the first place. And folks are going to look to you. And what you're going to be able to say is that I might not have made all the right decisions early on when I discovered that I was pregnant. But I now know what my role is, not only in my own life, but in this child's life, and in so many other mothers and children's lives, that every decision I take from here on will use that context. Every decision I have, I will have that backdrop in my mind of what that power is. And you're going to be even healthier for it forever. You're going to see her grow up. You're going to see her marry or partner up, because I don't know about what her choices are going to be. But you're going to be able to see so many things that so many other mothers never thought they would. And they're going to be able to say to you, thank you.
And I will echo that by saying thank you to each of you. And I appreciate your words.
We appreciate you too.
We appreciate
you.
you.
Thank you. Thank you.